Hello and welcome. In this video, we are going to practice recalling knowledge on endometrial cancer. On every slide, you will be given a question and then you will be given 10 to 15 seconds to answer the question. After 15 seconds, the bell will ring and the answer will be shown to you. It is recommended that you either answer the question verbally or you can keep a piece of paper with you and just write bulleted points of the answer, or you can do an audio recording of all your answers so that you can play back and confirm the correctness of your response. Please give feedback if this method of revision is helpful for you. I would request you to subscribe to this channel and send your comments as well. So let's start. Our first question is, what is endometrial cancer? And your answer time starts now. Endometrial cancer is also called uterine cancer, starts in the uterus lining. It is often due to hormonal imbalances. Common signs include unusual vaginal bleeding in pre- or postmenopausal women, pelvic pain, or weight loss. Diagnosis involves physical exam and tests like ultrasound and biopsy. Treatment combines surgery, radiation, and chemotherapy based on the cancer's stage and grade. Surgery typically involves removing the uterus. Early detection and treatment lead to better outcomes. Regular checkups and a healthy lifestyle can help prevent it. If you experience unusual symptoms, tell your doctor. Endometrial cancer usually has a good prognosis when found early. So let's move on to the next question. What are the factors associated with endometrial cancer? Your answer time starts now. There are some endogenous factors such as nulliparity, obesity, and late menopause after 52 years. Unopposed estrogenic stimulation of the uterine lining is also responsible. Some exogenous factors include the following: tamoxifen taken for breast cancer, combined oral contraceptive use, and cigarette smoking. What are the signs and symptoms of endometrial cancer? Your answer time starts now. Women may present with a history of irregular vaginal bleeding, either premenopausally or with postmenopausal bleeding. On history, the women who have had breast, colon, and ovarian cancers are high risk. Family history of endometrial cancer is a high risk. Obese women with diabetes, hypertension, and late menopause are at a higher risk for endometrial cancer. However, thin women can also develop endometrial cancer. So this will be part of the history taking. As far as physical examination is concerned, the findings will depend on the stage of the disease, as many endometrial cancers are diagnosed in the early stages. In early stages, pelvic examination findings may be entirely normal with no gross evidence of disease on the cervix and with a normal sized uterus. Next question. How is endometrial cancer diagnosed? Endometrial biopsy confirms the diagnosis of endometrial cancer. Histological findings are the standard for making a diagnosis of the endometrial cavity. After the histopathological diagnosis of endometrial cancer is obtained, several more investigations may be necessary to assess the extent of the disease, determine the stage of the disease, and plan the most appropriate treatment. The next question. What investigations will be done after you have made the initial diagnosis based on the biopsy? Your answer time starts now. After you have made the initial diagnosis, you will do a preoperative assessment, which includes routine preoperative evaluations, blood tests, for example, complete blood count, liver function test, renal function test, and an electrocardiogram, typically done to ensure that the patient is medically fit for surgery. Lymph node assessment can be performed depending on the stage and the grade of the cancer. A sentinel lymph node biopsy or pelvic lymph node dissection may be considered to determine if the cancer has spread to nearby nodes. CA-125 blood test is a tumor marker that may be elevated in cases of advanced endometrial cancer. It is not used for diagnosis but can be monitored to assess treatment response to recurrence. Chest X-rays to assess whether there is any signs of lung metastasis. Cystoscopy and proctoscopy are recommended if there is concern that the tumor has invaded the rectum or the bladder. Next question. What is the role of imaging in the diagnosis of endometrial cancer? Your answer time of 15 seconds starts now. There are various kinds of imaging that can be performed in confirming the diagnosis and also assessing the stage of disease. And these imaging modalities include pelvic ultrasound, which is a transvaginal ultrasound to assess the thickness of the endometrium and the presence of any other abnormalities in the pelvis. Pelvic MRI will provide detailed imaging of the pelvic region, helping to determine the extent of tumor involvement in nearby structures such as the cervix, the myometrium, or nearby lymph nodes. CT scanning may be done to evaluate the extent of the disease, especially to check for involvement of distant lymph nodes or metastasis to other organs like the lungs or the liver. Next question. What is the role of molecular classification in endometrial cancer? Your answer time starts now. So molecular subtyping has been added to the staging criteria to allow a better prediction of prognosis in a staging prognosis scheme. The performance of a complete molecular classification surrogate is encouraged in all cases of endometrial cancer for prognostic risk group stratification as potential influencing factors for adjuvant and systemic treatment decisions. If the patient has endometrial cancer with molecular pole MUT positive, then this denotes a favorable prognosis. However, MMRD and NSMP indicate an intermediate prognosis and therefore do not alter the stage, while PF3ABN indicates a poor prognosis. What are the different types of histology which are a characteristic of endometrial cancer? Your answer time starts now. So histology is a very important aspect that has to be understood when the diagnosis of endometrial cancer is made. And I would recommend that you study and remember this answer correctly. Histological tumor type is an important prognostic predictor, and all endometrial cancers are classified according to the 5th edition of WHO classification of tumors, female genital tumors. The following different histological types have been recognized: endometrioid carcinoma, which has different grades of up to high grade, serous carcinoma, clear cell carcinoma, mixed carcinoma, undifferentiated carcinoma, carcinosarcoma, and other unusual types such as mesonephric, like, and gastrointestinal mucinous type carcinomas. Our next question is, how do we evaluate the sentinel lymph node when we are making the final diagnosis of endometrial carcinoma? And your answer time starts now. So sentinel lymph node biopsy and sentinel lymph node assessment is an important part of the preoperative imaging technique. And so this can be done in various ways. It can be done before surgery or it can be done during surgery. The different methods are as follows. Lymphoscintigraphy is a preoperative imaging technique that involves injecting a radioactive tracer, usually technetium-99, near the tumor site, and then imaging will tell us if there is sentinel lymph node involvement. Blue dye injection is a dye that is taken up by the lymph node, and it can be done during surgery to visualize it much better. If there is a combination of radioactive tracer with the blue dye, the accuracy of the sentinel lymph node detection will be improved. Surgical exploration, the nodes are removed and sent for histopathology for examination during surgery. Intraoperative frozen section analysis can provide a preliminary assessment of whether cancer is present in the sentinel node while the patient is still in the operating room. A formal sentinel lymph node biopsy is something that is conducted after the surgery has been over, and careful examination of the sentinel lymph node will check for the presence of cancer cells using traditional histological methods. In ultrastaging, we mean that the sentinel lymph node may undergo ultrastaging, which involves more detailed examination techniques such as immunochemistry or PCR to detect micrometastasis or isolated tumor cells that may not be visible with standard histopathology. Completion lymphadenectomy: if the sentinel lymph nodes are found to be positive for cancer, the surgeon may perform a complete lymphadenectomy of the pelvic lymph nodes to ensure thorough removal of cancerous lymph nodes and to also assess the extent of lymph node assessment. So the use of sentinel lymph node evaluation in pelvic cancer should only be done by a gynecology oncologist, but it would be interesting and important to know some of the methods by which the sentinel lymph node assessment can be done, and the fact that it can be done preoperatively as well as during the surgery. Next question is, what is the differential diagnosis of endometrial cancer? Your answer time starts now. So differential diagnosis includes different clinical conditions, because bleeding from the lower genital tract can occur from the cervix, the vulva, or the vagina, and inspection usually helps to identify these lesions. Atrophic changes in the vagina may also lead to bleeding postmenopausally, particularly postcoital. Bleeding from the uterus may be due to any of the many types of benign lesions, for example, endometrial polyps, cervical polyps, endometritis, or to hormonal replacement therapy. With this, we come to the end of the video. Please press the like button, do subscribe, share with friends and colleagues, send comments, and also press the bell icon for notification of future videos. Thank you and goodbye.